Hello, we are from student group discussion B9 and would like to present our student project with the title of Left Ventricular Aneurysm in Acute Myocardial Infarction. These are the members of our group. My name is Dewa Putu Aisaka Rajeshi Arikandin with the last 3 digits of student number 188, and now I will start the presentation with the background of our student project. So left ventricular aneurysm or LV aneurysm is a condition in which the wall of the heart's left ventricle appears well-defined, thin, scarred, or fibrotic, potentially resulting in muscle loss or necrotic muscle presence. LV aneurysms are typically the outcome of a healed transmural myocardial infarction and occur in approximately 3 to 5% of patients. In LV aneurysm, the scar area takes the form of a thin pouch that connects with other parts of the left ventricle through a wide neck, causing loss of contraction function due to transmural necrosis. The occurrence of LV aneurysm is frequently associated to acute myocardial infarction or MI, with its presence typically asymptomatic. LV aneurysm could lead to serious complications if not detected and treated properly, so understanding the symptoms and risk factors of LV aneurysm can aid in early detection and management. So these are the problem formulations and objectives of our student project, and these are the benefits of our student project.
Good morning, everyone. My name is Ledwin Meikel Wibisono with the last 3 digits of student number 061. And now I'll explain about the definition of left ventricular aneurysm. So left ventricular aneurysm, or LVA, is a severe mechanical complication of acute myocardial infarction that frequently affects the left ventricle and apex wall. So LVA is characterized by partial myocardial degeneration and necrosis caused by pathological factors such as myocardial infarction and cardiomyopathy, resulting in myocardial thinning and the decreased strain capacity and a decrease or loss in its normal range of motion, and also with the scar tissue gradually forming the bulges that outward. And so the development of ventricular aneurysm will have a long-term impact on the heart function. And a prior report revealed that 30 until 35% of patients commonly experience LVA after acute myocardial infarction. And however, due to the rapid advancements of myocardial infarction revascularization procedures in recent years, LVA occurs in less than 15% of myocardial infarction. That's all from me. Thank you.
Swastiastu, Doctor. My name is Eyn Awdy Afza with last 3 digit number 102, and now I will explain about epidemiology of left ventricular aneurysm. Understanding the epidemiology is essential for elucidating its burden on public health and guiding clinical management strategies. The first one is incidence and prevalence. The early investigation documented an incidence ranging between 5% to 30% post myocardial infarction. To contemporary data suggests a diminishing trend likely attributed to enhanced revascularization method and secondary prevention measure. Second one, age and gender distribution. LVA predominantly affect the elderly, typically beyond the age of 50 years, while insight into gender-specific prevalence are seen. Certain investigation hints a marginally elevated incidence among males. The third one, risk factor. The risk factor of LVA onset include hypertension, diabetes mellitus, dyslipidemia, smoking, and familial predisposition to cardiovascular disease. And the fourth one, geographic and ethnic variation. Limited population-based investigation suggests elevated LVA prevalence in specific ethnic cohort, including individuals of African and South Asian descent. Probably genetic variability, lifestyle factors, and healthcare infrastructure likely contribute to this observed variation. Thank you. That's all from me. The next will continue by my friend.
Hello doctors and friends, my name is Stanislaus from Wangsadinata with the last 3 digits of Student's ID 115. I'm going to explain about the etiology of left ventricular aneurysm. So left ventricular aneurysm etiology may vary with the first group of the etiology, which is congenital aneurysm. The sporadic arrangement of the congenital aneurysm specify and differentiate it from the others. Congenital aneurysm is normally larger in size and mostly are lined with fibrous tissues, and it's unclotted blood and scattered among the ventricular cavity. The second group of etiology that causes left ventricular aneurysm is acquired aneurysm. The first one is ischemic. Ischemic left ventricular aneurysm happens usually as a complication of an acute myocardial infarction. This event is characterized by the dyskinetic movement during ventricular systole, which leads to several complications of the heart. The second one is traumatic. It is caused by any procedures that cause trauma to the chest, which can result to myocardial contusion, coronary artery laceration, which leads to myocardial infarction and formation of aneurysm. The third one is infective. Infective left aneurysm is a rare condition which infected the left ventricle of the heart due to bacterial endocarditis. This condition occurs as a complication of previous heart attack, which caused weakened area of the heart muscle. The last one is idiopathic. Idiopathic aneurysm are not specified by any underlying cause that can be ruled out. Heart conditions, surgical treatment, or morbidities or others may cause idiopathic aneurysm. Apart from the listed above, there are also several causes that may lead, such as hypertension, steroids, NSAIDs, and Chagas disease, and etc. That's all from me. Thank you.
Hello, my name is Putu Dinda from Sudastra with my student number is 130. Today I want to explain about pathophysiology of left ventricular aneurysm. Myocardial infarction that occurs due to occlusion of the left or right anterior descending artery is generally often complicated by a left ventricular aneurysm. Left ventricular aneurysm formation consists of two main mechanisms, namely the initial expansion phase and the final remodeling phase. So the first one is initial expansion phase. Within a few hours post-infection, thinning of the infection zone will begin, followed by migration of inflammatory cells into the infection zone in the next 2 until 3 days. Within 5 until 10 days, there will be lysis of necrotic myocytes. In the area of infection, extravascular bleeding can occur, which causes a decrease in systolic and diastolic function of the heart. And the next one is the final renovation phase. Within 2 until 4 weeks post-infection, the myocardium will undergo remodeling, starting with the appearance of highly vascularized granulation tissue, which will later be replaced by fibrous tissue within 6 until 8 weeks after infarction. So that's all for me. Thank you.
Om Swastiastu, doctors and friends. My name is Karralika, the last 3 digits of student number 246, and I would like to explain about the clinical manifestation of left ventricular aneurysm. The left ventricular aneurysms are usually asymptomatic and are only noticed after complications or during a transthoracic echocardiogram. And the symptoms that can be found are fatigue, shortness of breath, stroke, fluid retention, thromboembolic phenomenon in any part of the body, and visceral or limb ischemia. And on physical examination, can be found tachycardia, arrhythmias, abnormalities in heart impulse, and mitral regurgitation murmur. That is all that I have to say. Thank you.
Okay, next let me introduce myself. My name is Leonyta Augustyne with the last 3 digits 150, and I will explain about how to diagnose a left ventricular aneurysm in myocardial infarction. There are several imaging modalities can be used, such as the first one is the 2-dimensional echocardiography, non-invasive method that demonstrates a ventricular aneurysm and differentiate between true aneurysm by depicting a narrow neck compared to the size of the cavity. And then eye-color flow echocardiographic can identify abnormal flow within the aneurysm and detect thrombus. Post-Doppler imaging can detect an oscillatory to and from motion of the aneurysm that changes its variation with inspiration and expiration. And then 3-dimensional tomographic echocardiography used to calculate left ventricle systolic capacity and volume. Another one is cardiac MRI, can provide detailed anatomical and functional information about the left ventricle through the saturation colors of blood. And then their CT, computed tomography, can provide a reliable look of the aneurysm wall and the presence of mural thrombus. Left ventriculography can also demonstrate a large discrete area of dyskinesia or akinesia, usually in the wall parts of anteroseptal apical, and also reveals findings of mural thrombus. Another detailed evaluation is chest X-ray. Radiograph in anteroposterior or slight oblique view can also project ventricular aneurysm abnormalities, and in lateral view aneurysm often find rounded or oval shadow partially or entirely imposed. That is all from me. Next will be explained by my friend. Thank you.
Om Swastiastu, Doctor. My name is Putu Isyundra Kesuma, last digit number 003, and I would like to present about the treatment of left ventricular aneurysm. So the treatment can be done by cardiac procedure or also conservative drug therapy. For individuals, if they are having symptoms and also big aneurysm more than 3 cm, it can be done by surgical treatment such as PCI or CABG. However, if the individuals are asymptomatic and also having small aneurysms below 3 cm and also stable heart dimensions, it may benefit just from medication management. And in patients with large LV aneurysms with symptoms, the management is the same as asymptomatic cases, plus specific treatment for complications and also perform surgical treatment based on the indication. So for the medication, we can use ACE inhibitor or angiotensin receptor blockers to reduce afterload and also prevent ischemia, and we can use anticoagulation to prevent thromboembolism. So the indications for surgery such as documented expansion large size, angina, congestive heart failure, also arrhythmia. And there are relative contraindications such as greater anesthetic risk and also myocardial dysfunction. I think that's all from me. Thank you.
Let me introduce myself. My name is Jan Sumarga with last digit of student number 134. Complication on left ventricular aneurysm. Acute myocardial infarction with left ventricular aneurysm has higher comorbidity than AMI without LV aneurysm. Some complications that were found to be higher in AMI without LV aneurysm are ventricular arrhythmia, mechanical complication, cardiac arrest, pump failure, cardiogenic shock, LV thrombus, and strokes. Almost 1/3 of patients with ventricular aneurysm develop arrhythmias. Other complications associated are respiratory failure, bleeding, and dialysis-dependent renal failure. That's all from me. Thank you.
Okay, hello everyone. My name is Putu Diva Prilana Artha with 3 last digit names number 238. So I'll continue the presentation about the prognosis of left ventricular aneurysm. Okay, so left ventricular aneurysm remains a challenging condition with significant implications for patients' prognosis. Recent research has provided valuable insights into the prognosis of LVA, shedding light on various aspects such as mortality risk, arrhythmias, and heart failure. Recent research provides valuable insights into the prognosis of LVA. Moving forward, further studies are needed to refine stratification strategies, optimize treatment algorithms, and improve long-term outcomes for patients with this challenging condition. That's all from me. Thank you.
Hello Doctor and friends, my name is Nyoman Medhira with the last digit of study number is 070. Now I will present about the summary of LVA. LVA is a severe mechanical complication of acute myocardial infarction, characterized by abnormal bulging or dilatation of the left ventricular wall. LVA typically affects the elderly and may exhibit slight gender disparities, with males potentially experiencing a marginally elevated incidence. The etiology of LVA is multifactorial. Pathophysiologically, LVA formations involve initial expansion followed by remodeling phase post-MI. Clinical manifestations may include fatigue, shortness of breath, chest pain, and various cardiac abnormalities. Diagnosis relies on imaging modalities such as echocardiography, MRI, CT, angiography, nuclear imaging, and electrocardiogram. Treatment options include surgical intervention such as PCI or CABG. Prognosis is characterized by increased mortality risks, arrhythmia, heart failure, and potential benefits from surgical intervention. Further research is needed to refine risk stratifications and treatment approaches for LVA. So that's all from me. Thank you.
Hello everyone, my name is Grace Valerie with the last 3-digit student number 143 and I'm going to present about the recommendation. We hope that the readers will find this article useful. We recognize that this paper is far from being ideal and as a result constructive criticism and suggestions will be extremely beneficial in improving this writing. We recommend conducting additional research information regarding left ventricular aneurysm and acute myocardial infarction. That's all from small group discussion B9. Thank you for watching.